Hi, my name is Dr. Lai. I'm one of the ER physicians at Modoc Medical Center. I want to talk to you today about the new coronavirus called SARS-CoV-2 that causes the disease called COVID-19. It is a respiratory illness that has made a lot of people sick. It is a virus that has spread around the world. When someone coughs or sneezes, there are these respiratory particles in droplets that can fall to the ground or fly across the room. And if it comes into contact with your eyes, nose, or mouth, you can become infected. You can also become infected if you touch an infected surface and then touch your face. To prevent this from happening, it is essential to wash your hands with soap and water for at least 20 seconds or to use an alcohol-based hand sanitizer. There is evidence that show that there are viral particles that are so small that they can float in the air for several hours or travel long distances. This is especially problematic if you are indoors or there is poor ventilation. It is essential then to wear a mask to protect yourself against these viral respiratory droplets or airborne particles. There's also evidence that show that infected people sometimes won't show any symptoms at all. By the simple act of talking or singing, these people can spread the virus to others. It is also important to wear a mask so you protect others from getting infected. Now, in the United States, we're not accustomed to wearing masks on a daily basis. But there are people in many professions that wear masks regularly. People such as surgeons, dentists, professionals that work around toxic fumes and chemicals. They do this as part of their jobs. They have gotten quite used to wearing masks for long periods of time. Masks are inconvenient, restrictive, uncomfortable. I remember growing up, they were enforcing a law that said that we needed to wear a helmet in order to ride a bicycle. I felt that this was not cool, that it was restrictive and uncomfortable to wear. But over time, we have recognized the benefits of such a safety measure because it protects ourselves from harm if we were to get injured while riding a bicycle. Seatbelts, traffic lights, stop signs are similar in that these are safety measures that have a little bit of inconvenience to our lives, but they provide great benefit because it protects ourselves and protect others. Masks are the same thing. When you wear a mask, you're protecting yourself and protecting others. The difference between masks and those other safety measures I've just spoke about is that we do not have the luxury of time right now. The coronavirus pandemic does not allow us to adapt to wearing a mask because it spreads so rapidly. We need to act now. If you cannot safely distance yourself for 6 feet from others, or if you are indoors, it is important to wear a mask to protect yourself and to protect others. Please wear a mask for the greater good. Thank you for listening and stay healthy.